No one yet. Interesting.
All right, people are filing in. Welcome, everybody. Excited to have you here. We'll give everybody a few minutes to log on, get situated, and then we will get rolling.
Yeah, great to see everybody. If you wouldn't mind in the chat, just letting us know where you're from and what kind of work you do professionally, or if you've even heard of HPPD before. So I know it's kind of a strange, under-discussed phenomena.
Yeah, I'm definitely curious where people are calling in from. What's your background? You know, are you a therapist, a clinician? If you feel comfortable sharing, are you an experiencer of some sort? This is so cool. Nice, Ben. From Australia. Cool. Ben, you were the one that just emailed us, right?
That was a different Ben, but maybe.
Yeah, okay, cool. Neuro Group, right? You work for them? Sweet.
Great. Yeah, the psilocybin therapy in Oregon is looking very exciting. Glad you're working on that. Are you helping with the campaign at all, Ginger?
Sweet. Nice job. Keep it going.
Caymans, cool.
So much. Cool. Thanks for sharing, Miriam.
I'd love to come down to Grand Caymans and run a workshop. Just saying.
Hey, Darlene. Glad that you're here. All right. What time is it? I guess we'll do another minute or so, and then we'll get rolling. Cool. Thanks for sharing, Andrea. All right, and I'll just give everybody a heads up. If you catch any spelling errors, time started to slip away from me as I was putting this together. And I don't know about anybody else, but I seem to go down research holes and gather way too much information. So I was just filing through so much stuff and trying to organize it all. So
Oh, great, Ignacio. Thanks for joining us.
all right, sweet. What do you say we get rolling here?
Absolutely.
Sweet. Thanks for sharing, Leonard.
I'll be moderating, saving questions for the end, and then we can kind of run through all those together. And I'll also be participating with you in the chat. So I think we're good to roll.
Cool. I guess we'll kick it off first by just introducing ourselves in case nobody has heard of us before. So my name is Kyle Buller. I'm one of the co-founders along with Joe Moore at Psychedelics Today. I have an undergrad in transpersonal psychology. What got me there was having a near-death experience when I was 16, and then followed by some psychedelic experiences. It just really intrigued me and really caught my interest of how similar it was to a near-death experience that I had. And so found a transpersonal psychology program and just have spent my life studying this stuff. And Joe and I have a background in training in breath work. I've been going on about 10 years with that. And then I also wrapped up my master's in counseling and somatic psychology last year. And we have been running this project for over 4 years. So for all those that have been supporting us, thank you. And it's been an awesome journey so far.
And I'm Joe Moore, co-founder as well, and been studying psychedelics quite heavily since 2001, participating in holotropic breathwork since 2003, started running small breathwork workshops maybe 2 years later. And here we are today. Just so excited to be where we are in the psychedelic field. And yeah, just happy to be here and helping and playing a part. So let's dig in, Kyle.
All right. All right, so exploring hallucinogen persisting perception disorder, HPPD. This is a topic that keeps coming up, and it seems to be somewhat under-discussed at times within the psychedelic community. I'm approaching this both from a research perspective and also an experiencer of it. So I'll dig in a little bit of my story here as well, probably towards the end of this. And yeah, it's just a really interesting disorder, and it seems to be a lot of different theories, some controversy. We had a writer actually try to help us out with a blog a few months ago, and she kept running into roadblocks, trying to, get information from some researchers. Sometimes people didn't want to talk about it, or really just didn't believe it's a real disorder. And I heard that from two journalists trying to just dig up information, even though there has been articles and research with it. So we just wanted to dig in and just chat about it some more. So, this presentation is for educational purposes. We're not trying to assess, diagnose, or treat HPPD or provide any medical advice. So if you're experiencing symptoms, please seek out a medical or mental health professional. So the history of HPPD and flashbacks. So this was first described by Sanson, describing the prolonged effects of LSD in a paper. And Sanson, Spencer, and Whitelaw reported LSD experience usually lasts 4 to 8 hours, but may extend as long as 10 days. Typical experiences may also occur at intervals up to 8 days after the administration. 10 days being about the longest time for such reactions to occur. Delayed reactions may occur and may be as severe as the original reactions. So, this was documented in the early days of the psychedelic research. One term that I think a lot of people are familiar with is the term flashback. So that was introduced in the literature in 1969 by Horowitz. And in 1987, HPPD was introduced to the DSM-3 as post-hallucinogen perception disorder. And then it was then established as HPPD, hallucinogen persisting perception disorder, in the DSM-4 under the code 292.89/2000. So John Halpern is a researcher. I believe he was over at Harvard. It might still be over there. And he's done a lot of research with this. And some of his research suggests that flashbacks have been reported over 100 years ago by Alice in 1998, who described the prolonged effects of mescaline. I think sometimes people really got introduced to the idea of flashbacks kind of from this urban legend that LSD is stored in the body and spine. And if you crack your spine or move the right way, it will release remnants of LSD that might be stored in the body, which then hence triggers the flashbacks. There is a little Ask Sasha Shulgin on cognitivelliberty.com, and somebody asked about this, and Sasha replied to this question, stating that the idea that LSD is stored and flashbacks are released from the body somewhere was talked about at a DEA meeting in 1991 in San Francisco. And he said the indiscriminate, and this is what somebody was stating in this meeting that Shulgin was reporting, the indiscriminate use of LSD in the summer of love in the 1960s had led directly through the re-release of these hidden away molecules and the resulting flashbacks to the hordes of homeless and psychotic and disenfranchised here in the streets of San Francisco. I mean, when I read this, I see this kind of as a I don't know, a way to label and kind of, just kind of label them from people that might have been participating in that. And I don't know, it seems really shaming at times. So, how truthful is that, right? And it seemed like that urban legend kind of, I remember I got taught that in DARE class, like never take LSD because you crack your back and have flashbacks and you'll never be the same. So sounds like it got started with the DEA. Horowitz described 3 types of visual flashbacks: perceptual disorders, so being able to see halos or light trails, heightened imagery, seeing objects more vividly, and recurrent Biden images, so seeing objects that are not there. So what is HPPD? Hallucinogen persisting perception disorder is a condition recognized by the DSM that consists of prolonged / reoccurring perceptual effects after the ingestion of a psychedelic substance or any other substance has worn off. So somebody might take a substance and that effect might continue even though the substance has completely metabolized and is out of the system. The DSM-5 states that following cessation of the use of the hallucinogen, the re-experiencing of one or more of the perceptual symptoms that were experienced while intoxicated with the hallucinogen, geometric hallucinations, false perceptions of movement in the peripheral visual fields, flashes of colors, intensified colors, trails of images, moving objects, positive after images, halos around objects, and then macropsia, which is seeing things that are larger or smaller than they actually are. B, the symptoms of criterion A cause clinically significant distress and impairment in social, occupational, and other important areas of functioning. And that seems to be one of the differences here between flashbacks, is that HPPD can cause significant distress. And it's also a prolonged thing. Flashbacks seem more acute. And the symptoms are not attributed to any other medical condition, such as lesions, infections of the brain, visual epilepsy, and are not better explained by another mental disorder. And with that said, there are reports that HPPD may be misdiagnosed pretty often. And a lot of the research points towards that people that are, self-describing HPPD may have some sort of underlying mental health disorder, or may be showing some sort of psychotic features. So, yeah, it seems there's some confusion at times on how to really diagnose this and what's really going on here. And Joe, feel free to stop me if anything pops up in the chat or Q&A.
Yeah, you got it.
Since I can't see anything.
Yeah, no worries.
All right, so types of HPPD. Reactivation, this is a new definition that just that I have seen pop on the scene. And it's shown up in the 5-MeO-DMT literature. So Dr. Alan Davis, Dr. Malanu Tog, they talk about it. And so, yeah, Malin has written this awesome book about 5-MeO-DMT. And those are thesis and gets into the reactivation. So being able to re-experience. But the interesting thing is that a lot of people talk about it not actually being too distressing. Malin writes, however, up to 96% of the users with reactivation report it being positive or a neutral experience, and only 3% of the reactivation experiences being negative. And that also comes from Dr. Alan Davis as well in some of their research. So HPP1 consists of acute reactions, reactivations, flashbacks. Most studies report that experiencers did not find this form of HPPD too distressing. Some report that it can be pleasurable, controllable, kind of like a controllable trip. Some people can report just kind of like staring at something and, maybe it starts to move or shift or shimmer. And, maybe that's a desirable effect for some folks. HPPD2 describes the prolonged and persisting effects of a substance That can include symptoms like visual trails, halos, after images, visual snow, depersonalization, anxiety, derealization, and depression. All right, and I know we kind of went over some of those symptoms and some of those other descriptions, but here are some other symptoms of HPPD2. Objects appearing further away or nearer than they actually are, objects appearing larger or smaller than their actual size, criticism and ego dystonic psychosis, patients manifesting criticisms towards one's own thoughts, perceptual disturbances, as well as experiencing perceptual disorders perceived as inconsistent with one's self-concept or ego state. Depersonalization, which is a state in which some people feel that they are kind of not really themselves, or outside, the outside world is unreal. Derealization, a state in which the individual feels a detachment within the self regarding one's mind, body, or being detached observer from oneself. You might feel like you're in a dream, or feeling like you're inside a transparent bubble. Yeah, the world may not be real, what's going on here. Which, you know, can also happen during psychedelic experiences too, right? People might feel like things aren't really real, they're kind of outside of themselves, maybe they're watching themselves from a distance, and sometimes that continues on. Feeling light or heavy in the body, visual trailing, so a transient disturbance of visual motion perception of unknown origin. So sometimes people will like move their hand and maybe they see their hand trail along, or cars coming at you, and especially during the night, and then the light kind of trailing behind that. Halos around objects, geometric shapes, usually in the form of discs, circles, rings, rayed structure around the object, really present. After images, an image that continues to appear in one's visual field after the exposure of the original image has ceased. Other visual disturbances, flashes of color, intensified colored, geometric images, and false perception of movement of images in the peripheral field. So yeah, just even looking at this list, you could probably tell how distressing that could be if you took a substance and it feels like the substance hasn't really worn off. You know, these things are still going on. Do you ever get back to baseline? You know, then what is, I guess, considered your quote unquote new normal if you're starting to really experience a lot of this stuff on a day-to-day, which could be really scary for a lot of folks that are experiencing this. So the prevalence, in 2018, the National Survey on Drug Use and Health estimated around 5.6 million people, around 2% of the US population reported use with psychedelic substances. From various studies and reports on HPPD, a lot of researchers, clinicians state that HPPD2 seems to be really low and considered pretty rare. Around 5 to 50% of the psychedelic users report flashbacks. So thinking about those more acute experiences, and the probability of developing HPPD may be lower than these numbers. Dr. Passy writes in the Science of Microdosing Psychedelics, it appears somewhat astonishing that no case of HPPD was ever reported from all the experimentation up to the 1960s on more than 10,000 experimental subjects and patients. And I'm wondering kind of what he means by that. You know, just kind of stated in the past that it was reported that there were some prolonged effects. Dr. Stanislav Grof reports some of that stuff as well, but it wasn't, I guess, classified really as HPPD back then. But it seems like there were pretty low amounts of reports of that. And as I mentioned, some reports and studies suggest that there might be an issue with misdiagnosing, and the person who is diagnosed with HPPD might suffer from things like seizure disorder, psychosis, migraine, or without the headache. And despite researchers, clinicians stating that HPPD is low and rare, there's various internet forums like Reddit and Facebook groups from experiencers who really report a lot of their struggle with the disorder. And it does seem like it might be a pretty small niche subsect of people suffering, but to say that this might not be a real thing, I think that can be really distressing to people that are suffering. And there's a lot of people out there that are struggling with this as well. So just something to be aware of. So the cause seems up for debate, but Halpern and Pope report that HPPD seems more prevalent among recreational use of LSD versus the clinical and research use of LSDs, which gets me thinking of set and setting, what's coming up in a person's experience. And if they are in a clinical setting with research, maybe they have that container to work through whatever's going on, versus being out in a recreational environment. Maybe they're not aware of different things that might be coming up, or something traumatic happens and that triggers. So maybe that is why the clinical use is much lower. But HPPD does seem like generally associated with LSD, which is really interesting. Ben Sessa had an article out describing a client who suffered from it from cannabis, and it does seem that cannabis and other substances like alcohol can really trigger HPPD. So say if somebody started developing flashbacks, and maybe those experiences started to trail off, and then they would maybe ingest cannabis, and then it would really reactivate their flashback symptoms. And so going through a lot of the forums and groups, you do see a lot of people talk about cannabis use really amplifying their symptoms, and a lot of folks really say to try to abstain from cannabis. But it also seems that HPPD and these flashbacks can be induced by cannabis, other psychedelics. There are some reports, people developing it from psilocybin mushrooms. I did read one study about a specific mushroom, forget what it was off the top of my head, that was really attached to developing HPPD. And then other novel psychoactive substances and synthetic cannabinoids. But yeah, interesting that it seems to have a higher association with LSD. And the cause of HPPD really remains unknown, uncertain, but there's various theories as to what causes it. So Elson, Wright, and Sessa suggest that there's 3 theories for HPPD. Individuals might have a heightened awareness to normal visual phenomenon. And the way that I'm kind of interpreting that is, you're on you ingest a substance and you become more aware of, the world in a different way. And maybe to some individuals, that heightened awareness kind of sticks around, and maybe it's hard to maybe not see the world in that way after experiencing that. Perceptual symptoms might represent memories of an acute intoxication experience accompanied by a high level of emotional distress. And then symptoms could be due to some neurological change induced by drug exposure, disinhibition of the visual processing related to a loss of serotonin receptors on inhibitory interneurons. Baggett suggests that HPPD may have more to do with the vulnerabilities of an individual rather than pharmacological mechanisms. So maybe somebody is more susceptible to anxiety, maybe there is some underlying mental health disorders there that could emerge during a psychedelic experience. And, these are symptoms that are just continuing to unfold. When I was chatting with Dr. Torsten Passy for our podcast a while back, interviewing him about his book on microdosing, I did bring up my story with HPPD and just his thoughts about it. And we got into a discussion about Dr. Passy really thinking that it could be some sort of trauma response. So kind of going back to number 2 here, that Sessa puts forward about like a re-experience of memories. But, maybe something traumatic comes up, and that's what's really kind of creating this new way of being. And maybe it could be trauma stuck in the body. It could really just increase anxiety, and, might not have much of a biological mechanism. But again, there's not too much research, and I'm hoping people do more research on this, because there's a lot of people that, as I said, are struggling with it. And I think having a lot of confusion around it, probably causes more distress. And I wanted to go back to the cannabis piece for causes. Sometimes we don't really think about cannabis maybe causing some of these symptoms. But with the high potency cannabis that's coming out now, especially like waxes and oils and stuff like that, I think, you might see people, and I did have a client come in for counseling last year, or maybe it was a year and a half ago or so, who had, I believe it was oil, and they didn't really know how strong it was, but this was about 2 to 3 weeks afterwards, and they were still experiencing a sense of depersonalization, derealization, and it was really frightening, and they felt like a part of themselves just could not come back to the way it was. And so, just something to consider as well with cannabis. All right. So we'll talk a little bit about treatment. So in a web survey study that Baggett and Irwin and a few others helped put together of 2,455 people, 104, so 4.2% of the participants reported that their visual experiences were troublesome and thought about treatment. Thought about treatment there. So yeah, a pretty low percentage of people thinking about, it was so bad that they were thinking about needing to get help there. 70% considered treatment during the first 2 months after symptoms developed. And then 27 out of the 2,455, so 1.1% actually sought treatment from that survey study that they did. Treatment options seem largely anecdotal. So again, I think we need more research on treatment options. Sessa puts forward some treatment options. So sunglasses seems really helpful for some people. Might cut down on some of the light intensity. Psychotherapy, behavioral modifications can be helpful. And then some pharmacological and medication agents have been helpful, but a lot of the medication articles out there really consisted of small sample sizes, small case studies. And there was various reports on what was actually helpful. Some antipsychotics seemed really helpful. One of the anti-epileptics seemed helpful. And it was really interesting. Some of the studies out there were suggesting that some of the SSRIs actually exacerbated symptoms even more. So some people that were on medication, they actually felt like their HPPD was getting a lot worse. Oh, Micah, neurofeedback and neuromodulation. I didn't put it on there, but you have an N of 1, right, of that? Maybe if you want to drop some stuff in there about that. Yeah, I think, being able to explore different treatment models would be awesome, something like neurofeedback. And I guess I'll get a little bit into my story a little bit after these slides here, kind of tell you what I went through and what I found to be helpful. All right. Cool, Danielle. Yeah. All right, sorry, getting distracted by the chat room. If you follow our project, Joe and I are really influenced by Dr. Stanislav Grof's work. So I went back into his work to see if he had anything to say in LSD psychotherapy. And he had some interesting things to say. And I think this kind of comes up to this theory of unresolved experiences. So the occurrence of various perceptual changes after unresolved sessions is relatively less frequent. Long after the pharmacological effect of the drug has subsided, the patient may still report anomalies in color perception, blurred vision, after images, spontaneous imagery, and alterations of body image, intensification of hearing, ringing in the ears, or various strange physical feelings, sometimes various combinations of the above emotional, psychosomatic, or combinations of the above emotional, psychosomatic, sorry, I didn't see that comma there, ideational, perceptual changes constitute completely new clinical syndromes with the subject that has never experienced before. The occurrence of new forms of psychopathology can be understood as the result of activation and exteriorization of content of previous latent unconscious matrices. These symptoms usually disappear instantly when the underlying material is fully experienced and integrated. And he goes on to say, an active and unresolved matrix, whether of psychodynamic, perinatal, transpersonal nature, will influence the subject's perception of himself or herself and of the world, emotional reactions, thought processes, and behavior patterns in a specific way. The clinical symptoms that are psychogenetically connected with the activated functional system may persist for days, weeks, or even for unlimited periods of time. Sometimes the adverse after effects of a session are limited to the accentuation and intensification of the original emotional, psychosomatic, and interpersonal problems of the patient. So when I really think about this, people having, thinking about LSD or HPPD coming from LSD and recreational experiences, unconscious material really coming to the surface and not having a place to really work through. So, coming from this depth approach, really we might be dealing with unprocessed, unresolved psychological material. And it seemed like through Stan's work, to be able to resolve that, to go back into the experiences were really helpful for the full resolution of those prolonged symptoms. And just an idea, HPPD as a spiritual emergence. And so I'll share a little bit of my story here. I was 20, I believe. Yeah, 20. And, I went out with some friends and we planned a date to do some hiking. And we had maybe what I thought was LSD. I don't know, I didn't test it. So that's what I thought it was. It could have been something else. And I really thought about it for a while. Maybe it was something else. And I had this experience on it where I was meditating and, I was really approaching this from wanting to have somewhat of a spiritual experience and to really go inside. I was in nature. And I remember I was sitting on top of this mountain overlooking this lake, and I was just meditating with it. And something spoke to me and said, you know, you never have to take this ever again. Once you walk through the door, it's always there. And I thought, oh, well, that's a really interesting insight to have. And from that moment on, it felt like I never came up from it and I never came down from it. I just kind of existed within this world. And I think I ingested that around 10 a.m. So we were thinking, hey, we'll spend the whole day in the woods together. And it just kept going on. And it felt like it was just never going to end. And I remember trying to go to sleep for a while. You know, 12 p.m. rolls around, 1 p.m., 3 p.m. And every time I close my eyes, all I see is just, you know, this totally different 3D dimensional space. Every time I would open my eyes in the darkness, everything was pixelated. We talked about a little bit with like the visual snow. Felt like I was just staring at a computer screen and I could see all the color pixels. I think I finally was able to drift off to sleep around 5 a.m. I woke up and it felt like it was continuing. And it's just never really felt like it went away. And it was really distressing. I didn't know what to do. You know, a week went by and I still felt like I had some symptoms. I started to have a really hard time driving. The trails from the lights, especially at night, my vision, I guess, became really sensitive to light all of a sudden, especially at night with the lights just shining. Had a really difficult time driving that whole summer. I was having a lot of depersonalization. I wasn't too sure if I was still in a trip or not. A lot of anxiety was heightened. And I did try to seek professional help. I went to the doctors, I went to a therapist, and nobody really could tell me what was going on. The doctor told me, you know, LSD metabolizes usually out of your system, and we don't really know what's going on here, but we'll give you an SSRI or something like that. And for some reason, it just didn't really resonate with me. I was like, I don't know. Decided to go to a therapist, and they really didn't have much to say because I guess they obviously weren't, you know, versed in psychedelic literature, and it almost felt really shaming. It was like, well, why would you do that? You know, like that was a really dumb decision on your part. And you know, I felt really kind of ashamed of what just happened. And there was a lot of regret. Like, why did I do that? I felt like I played like Russian roulette with my brain. And this is my first and only experience at the time with LSD, or what I thought was LSD. Hopefully it was. But you know, it really frightened me. And because, you know, nobody ever told me that I could have persisting effects. And, you know, I had some pretty powerful experiences with psilocybin earlier on. And those were really mystical. And I did a lot of work processing my near-death experience with that. And so, you know, I wanted to explore something else. And I felt so much regret for the longest time from this experience. And it felt like it lasted for about 3 to 4 months. It just felt like the symptoms weren't really going away. I was having outer body experiences. And then to, you know, kind of throw things on top of it, I was also, I got bit by a tick, so I wasn't too sure if I was developing symptoms of Lyme. Every time it came back negative. So there was all these weird little variables going on here as well. So, you know, you could see maybe how these things do get misdiagnosed, or maybe the morbidity here of there's a lot of things going on and what is going on here. But it took me years and years and years to process this. But that whole summer, I really spent my entire time trying to figure out what the hell was going on. And it led me to Stan's work, and it led me to Ramdas, it led me to all sorts of psychedelic literature. And I read something from Stan where it was in Doorway to the Numinous, LSD Doorway to the Numinous. And I don't remember exactly what he said, and I was trying to find the quote, but I didn't have his book on me. I just have LSD Psychotherapy and a few others. I have my books, a bunch of my other books locked in another place that I can't find at the moment. But I was trying to find this quote, but something that really stuck out was he was saying during his clinical research, he would find that people might get stuck in an experience if they have unresolved psychic material. And, he talked about this non-specific amplifier of mental or psychic processes. And what he said was that, when people didn't feel like they had full resolution, it's as if you activate the unconscious material. And if you're distracted or you're not really paying attention to it, it tries to come to the surface to be processed. So, we talk a lot about the inner healer or this inner radar, thinking that when we're working with holotropic states of consciousness, this inner healing intelligence is trying to bring things to the surface to process from the Groff and holotropic breathwork framework. So thinking that maybe I was out hiking, not really paying attention to, maybe I was reliving some trauma. I have this pretty significant trauma in my background of this near-death experience. Obviously, I'm more susceptible to a lot more different things. Because of this experience, I had big bouts of depression and some suicidal ideation after this near-death experience for various reasons of wanting to go home. That's the experience I felt when I was dying. I was going home, and coming back was really difficult. So, I might have been processing all this stuff during my hike, but maybe it was processing more on an unconscious, like in the unconscious, and didn't fully come to the surface. And so, the way that I was reading this from Stan was, it's as if, you put on this vinyl and it starts to spin, and then you just never really listen to it. And so it continues to spin in the unconscious, and it's spinning in the unconscious is the reason why I'm continuing to have these prolonged effects. And for some reason, that just really stuck out to me in Stan's work. And I said, man, it feels like, this person really knows what he's talking about. And I feel like maybe that's what I'm going through. And one of his recommendations was when he said, when he found people in that state, they would just redose people to really get that full resolution. Well, I was completely terrified to ever touch anything ever again after that experience. So that definitely was not in my books. But that experience led me to a program where I was able to study this stuff more in depth, and I fell across some teachers, Joe and I's teachers, Lenny and Elizabeth Gibson, where I was able to have a holotropic breathwork experience. And this holotropic breathwork experience really brought maybe all this content to the surface, and it was a really profound experience. And I started to process things a little bit more somatically. And as I started to do a lot more inner work, the symptoms started to decrease. And they weren't as distressing as they previously were. And so I remember doing a research paper. I was taking an independent study on warriorship, and I came across this quote. Said, life is like a tea bag, dips you in hot water to see how strong you really are. And for some reason, when I read that quote, I thought back to that experience where everything got amplified after that psychedelic experience. And I said, wow, if I never had that experience, I would never have started this path. And so I started to look at that experience as a spiritual emergence. And the more work I did with that, it felt like it started to resolve itself. Once I started to dig into that unconscious material that was trying to arise, that I guess I wasn't being conscious of at the moment. And so the more inner work I did, and the more breath work I did was really helpful. And breath work for me was a really helpful modality because it helped me get back in my body. I think sometimes I felt so cognitively out there, kind of out in the ethereal realm, thinking, being very analytical, trying to solve this problem. And getting back to my body and doing breath work that way, that really helped me kind of process things in a much different experience. So, I'm just kind of tossing that out there, is that, could could these experiences sometimes be somewhat of a spiritual emergence? And I know that's kind of a tricky, topic to explore, but that's the way that I've really explored this for myself. And I know that's not going to resonate with everybody. But that was kind of like almost the way that I started to approach, how the hell do I fix this thing where everybody's telling me they don't really know what it is, there's really no treatment. There felt something that was going on internally that really wanted to be resolved. And every time like it tried to, I kept pushing it down because I didn't have that safe container there to really process it. And so, it really makes me think about some of the recreational use where, this might get reported more often, is that maybe there is, this depth content that's still trying to be processed. And obviously this is hypothetical, and this is why we need more research on different treatment modalities. What is really going on here? Is there something going on in the brain where it's actually affecting the eyes and the visual sense organs, or could it be chemical imbalance of some sort? I don't know. I think we need some more research to really figure out what's going on here. So I noticed that we're at 3:45, so that leaves us for about 15 minutes. And I guess this also kind of concludes my little presentation here. So,
Cool. So first question from Ginger here is about microdosing. Kyle, do we hear much about microdosing in HPPD? I personally have not.
No, Dr. Passy doesn't write too much about that. He said, typically it seems that some of the the reports are coming from medium to high dose sessions. So he said, the chances of developing HPPD might be pretty low for microdosing. And let me see if I can find that exact quote here in the book.
Right, like microdosing is a terribly complicated field because there's not a great amount of mutually agreed upon definitions too. Like some people are considering a 0.5 gram of psilocybin or like 50 micrograms of LSD a microdose, and that's not really what the definition is meant for. It's meant for subperceptual dosages. And yeah, a lot of people just don't necessarily have the same terms in mind, Kyle.
Yeah. So Dr. Passy said, it's also worth noting that even if there were corroborated risk of developing flashbacks or HPPD with medium or high doses of LSD, the risk may be absent or minimal with very low doses. For example, it's known that flashbacks appear more frequently after so-called bad trips or, quote, horror trips, i.e., experiences that have serious negative impact on the psychological state of the person. So again, kind of coming back to that trauma theory, right? Like something traumatic might have happened to a person. You might start to re-experience a past trauma. You might be dealing with really difficult emotions, and then thinking somatically, how does that imprint within the nervous system? Could that be a trauma? The psychological trauma from experiencing something horrifying, or, diving deep down existential rabbit holes and not too sure if you're alive or what's the meaning of anything, or, all sorts of stuff can really emerge. So, could this be imprinted trauma at times from the experience?
Mm. And Kyle, how long, Miriam's asking here in the Q&A, like how long you actually had symptoms before they subsided for you?
I mean, it was pretty solid for like 3 to 4 months. I always say I was kind of stuck in a trip for 3 to 4 months, and it was pretty horrifying and pretty scary. I'd say that it was probably another year or so after that they started to really resolve. And I'd say I don't think they've ever fully resolved. Like there's still like little things that happen.
Like driving at night?
Yeah, my light sensitivity has never really decreased after that. you know, and sometimes
Mm.
I'll get little tracers or trails, but I don't find them really distressing at times. But I think I've just developed a relationship with it a little bit in a different way, where it's definitely not as intense as those 3 to 4 months. I'll say that. And you know, right now I wouldn't say that, like, you know, I have any physical or psychological distress from the experience at this point. You
Great.
know, who knows? Maybe there are certain things that continue that I'm just really not aware of. I always think, I'm like, what's my sense of normalcy before that experience and versus after that experience? And I'm like, well,
Mm.
you know, there's like little things that cross over. So it's really hard to tell at this point. But I would say, yeah, from those 3 to 4 months were really challenging for me. And then it wasn't until I really started to go back in and have the courage to go back in a safe place. And I feel like that's where breath work became such a crucial tool for me. We had a very, very safe place to process, you know, all these different traumas in a different way. And that group container and, you know, just the retreats that Lenny and Elizabeth hosted, like I just started feeling so safe that I could just really fully express what was going on there.
Safety is huge. Um, So Andrea asks here, so I have a 23-year-old female patient who took some sort of ecstasy about a year ago. Ecstasy is a complicated term. We'll get into that in a second.
Mm-hmm.
And seems convinced she has HPPD2. I think it's GAD, onset exacerbation by substance. Symptoms are depersonalization and anxiety. HPPD is HPPD known to happen after MDMA or ecstasy type substances? So ecstasy is a really tricky thing. It's not clear that it's MDMA. If it was MDMA and that was tested, great. Ecstasy is often blended with all sorts of things. So any thoughts on that one, Kyle?
Yeah, I mean, there are reports from people developing symptoms after MDMA, like I said, cannabis, other novel psychoactive compounds. 2CB was a big one that also came up. So, you know, I wouldn't say that that's out of the books. I actually, now that you're saying that, Andrew, it reminds me of somebody I worked with in the past who they came to where I was working for a first break of early episode psychosis. And as I started talking to this person to find out when this really happened, they said they were at a party and they drank a drink that they believed contained a massive dose of MDMA and other substances. And they said from that moment on, they never felt the same. They were having all these headaches, these kind of outer body experiences. And so, again, thinking about what was that person going through? Was it traumatic? And, you know, I'm coming back from kind of like these somatic imprints. What was going on there for that person at that time? But yeah, I mean, I wouldn't say that that's not possible with ecstasy or MDMA.
And,
but again,
Mark,
you know, you're talking about like generalized anxiety disorder and this and that, depersonalization. You know, this is one of the issues I think with it, and a lot of the research that was coming across from all these articles where they're trying to, you know, some of these self-surveys or, you know, these reports, and then starting to dig into somebody's mental health history. You know, they're already prone to anxiety. Maybe they weren't diagnosed with something, but it was there in the family history. And so, you know, I think coming back to that vulnerability piece, you know, what is the individual's vulnerability? Could that exacerbate something that's already going on inside the psyche? And again, I don't know, is that always fair to say, right? Like, you know, somebody might actually have something like HPPD and then just say, oh no, like you had this undiagnosed anxiety disorder. I don't know, is that fair to say? Maybe not. Because I'm sure there's a lot of people that are suffering that don't feel that way, right? So.
And Kyle, when was that LSD
sorry.
experience that you had that triggered a lot of this stuff? Or was that mushrooms?
I was, no, that was LSD. I was 20, so that's almost 13 years ago.
Okay. Another question here. Leonardo's looking for the book cover, I think from Malene, and then is asking a question about the percentage with 5-HO-DMT. I don't think we're really going to be able to speak to that here, bufotenine versus 5-MeO-DMT. But yeah, the exploration of naturalistically, yeah. So hopefully that works for you.
Backwards. Naturalistically, the exploration of naturalistically used ayahuasca and 5-MeO-DMT.
There we go.
You can find it on Amazon. This is her dissertation, and so she goes through ayahuasca, 5-MeO, in naturalistic settings, and
I assume highly technical.
If you want to learn, highly technical, yeah. If you want to just learn a little bit more, you can also listen to the podcast that we just did with her within the past few weeks. So I was just trying to bring a bunch of stuff up from her dissertation here.
Cool. And the next question here from Ginger. You mentioned most cases are tied to LSD with some reported cases on mescaline. Is there the chance that it could happen with any other psychedelic drug?
Yeah. I mean, some of the reports are saying it can really happen with anything. But it seems to be most associated with LSD. Why is that? I don't know. Some of the neuroscience that's come out in the past few years is really interesting. So, I mean, we know that LSD metabolizes pretty quickly out of the system, but it also does something interesting to the 5T2A receptor where it kind of binds onto it, hugs it a little bit more than just like attaching to it, like grips it. And so,
right, it's not just like a plug, it's like a,
it's like hugging it.
And they're saying it's a dirty drug. That's not a single receptor site drug. It's kind of like hits a lot of stuff based on its design. So that could be one of the reasons. Like maybe the other ones are cleaner and that they had very specific sites. But it's, there's so many compounds, so I wouldn't be surprised if other drugs could trigger it too. But again, early days of the research, people who are kind of cheerleaders for the movement don't necessarily want to acknowledge that this thing exists. It's not necessarily in their interest. So, that's why we're trying to bring this awareness to the table and hopefully get more people researching. Yeah.
So, you go through any of these forums and groups. I mean, there's a lot of people that are suffering.
Even one of our close friends, Kyle, doubts that it exists, and he's a psychiatrist at a very leading hospital, and it's like kind of shocking to me. But I get where they're coming from a little bit, but we shouldn't discount reports from folks about what they're experiencing. Like people are like, oh, it's a government conspiracy to keep psychedelic research down. It's like, no, people are hurting. Yeah, 29 years. Yeah, exactly. Thank you, Ben. Yeah, and as this stuff 24/7, that's unbelievable. You're a survivor. Yeah, we'll be in touch, Ben. There's this Micah in the chat mentioned this protocol that we're investigating, and it could be really helpful. We'll be in touch about it for sure.
Yeah.
Oh, people would tell you that. Yeah. No, you're not. But yeah, I think it's like a false cause. Like they're sure you're seeing stuff all the time, but they're like, oh, it's got to be something else. It couldn't be from the LSD. Yeah, it's a tricky, complicated thing, but it's where we're at as a culture.
Yeah, and I guess it comes back to right? Like, are the psychiatrists and medical doctors saying it's not a real thing because there's no, they can't figure out the cause of it within the brain? Is there disruptions within synaptic firings and neurotransmitters and whatnot? Like, is there a location in the brain that they could find that this is causing it? And is that why it's not real? Or is it more of an emotional disorder? But I mean, I don't know if anybody read there was a Forbes article kind of saying, a lot of mental health disorders might not even be disorders, right? How are we viewing a disorder, right? Could be emotional distress, right? And does that have a biological basis?
DSM is ripe for critique. Just put it that way. One last question.
Wait, you posted
here.
the history of the DSM in the chat or in our Facebook group?
In our Facebook group, yeah, it was a really interesting video on the history of the DSM and a lot of the preconceived notions that went into the founding of that, the group that makes that document or the book. So Mark asks, have any of your future, or I guess contemporary experiences re-triggered that, even if it was just for a short period of time? Like, I thought that CBD thing was interesting, but I don't know if we can say it's related. You know, it's a hard one.
Cannabis in my early years, I had a really hard time with it. That was definitely something I had to stop after that experience. Every time I'd go into it, it really amplified it. So I guess some other things that would amplify it: not getting enough sleep. I think stress was a huge amplifier of it at times. Yeah, I don't know if you listen to the podcast it was the one with Dr. Mike Hart. I described an experience with CBD. I was with Joe up in Vermont and took a little bit of CBD. And this was about a month after I got back from Soltara, so my ayahuasca experience. And I mean, I was back in the ceremony. I was having visions again just from CBD. And, would I say that was something HPPD related? No, I don't know. For me, it didn't feel like that. Like, was it a flashback? I mean, it could have been, but I don't know. I think I was viewing it as a much different process. It was kind of distressing me, like, what the hell's going on here? But it was more of like, oh, wow, there's actually this content that wants to be processed. And I did a lot of kind of like trauma release within my body with that experience. So again, I guess it could also be context, right? Like, for me, when that stuff is coming up now, I go, oh, here's content to engage with. Here's psychic material, somatic material to work with. And instead of getting scared and be like, oh my God, I can't control this, what the hell's going on? It's like, oh no, this is stuff that is wanting to be worked through. So I guess if I ever did have those type of experiences, I really try to create that container to work through a lot of the emotional and somatic stuff that's emerging for me.
Well, I think we should start wrapping here. We're at time. So thank you all for joining. We've got a podcast, a ton of blog articles. We keep hiring journalists to do great work for us. We teach classes online for medical professionals, therapists, regular folks as well. That's all at psychedeliceducationcenter.com. Kyle, anything else you want to mention before we wrap here?
No, I just want to say thanks everybody for joining, and thanks for taking the time to checking this out. And yeah, under discussed topic, I think we need to chat about it more, and hopefully inspire some people to do some research down the line. So we can have conversations about it and be really honest. I think as we teach in our online course, people are probably coming into therapy a little bit more, wanting to have conversations about psychedelics. And, I think a big thing that HPPD goes unreported is that there might be a lot of shame around it. I know I felt really shameful around disclosing I had an experience. And so the legality of disclosing I took this substance. So, I think the more that we can be open and try to be open-minded about this, how can we really help people through it without feeling so shameful and not feeling afraid to find professional help? So yes, ending the stigma. So yeah, I just want to say thanks everybody. Thanks for joining. I hope this was helpful for you. And yeah, thanks for all the support, and we'll catch you next time. Take care.
In the future, everybody. Bye-bye.
Thanks. Have a great weekend too.